The treatment of eating disorders is very complex. I say that actually with hope, because when we know what eating disorders are truly about, we can heal people from the inside out. When I started as a psychologist, there was a most unfortunate myth. And the myth went, once you had an eating disorder, you were destined to struggle with that eating disordered behavior for the rest of your life. You see, I had seen people get 100% better. I had seen people fully recover. In fact, I was one of them. So I set out on a mission to not only educate other professionals, but perhaps more importantly, to provide clients with hope.
Eating disorders are absolutely treatable and curable, 100%. That's really important. We need to identify eating disorders as such. This is not just, an unhealthy relationship with food because you like food too much. And when we look at the factors that are truly going on underneath the surface use of food, that's when we get to the healthy resolve from the inside out.
Any form of a diet, all that's going to do is it's going to play into exacerbating this diet, binge eat, more weight, diet, binge eat, more weight cycle. Binge eating is not about appetite. It's not about being too hungry. And therefore, appetite suppressants do nothing to help somebody who has binge eating disorder.
Ozempic, which is not FDA approved for weight loss, it actually is FDA approved for treatment of type 2 diabetes, does affect blood sugar levels. It has mechanisms that actually slow gastric emptying. It's going to make you feel full for a longer period of time. But we know that that's not the only reason why people eat, right? We don't eat only for hunger.
We all have emotions that get activated and need to be calmed. But if for some reason we don't want to respond to ourselves, or we don't give ourselves permission to self-soothe in healthy ways, our psyche is going to step in and take over and do it for us. And I like to say that for every human being, food is the first default self-soother that we all fall back on. For the past 40 years, cognitive behavioral therapy has been the leading treatment of choice. But this primary treatment model is merely 50% effective. If there was a first choice of treatment for cancer that was only 50% effective, wouldn't you be demanding additional treatment models?
Complex trauma affects our relationship with our body, our relationship with our emotions, or our ability to process our emotions in a healthy manner, and ultimately our relationship with ourselves.
To understand these disorders, we have to understand what truly happens to people, so we open the door to healing. If you chronically starve yourself, you feel numb. You're detached from both your emotional self, but you're also detached from what I call your body self. What ends up happening is we are overwhelmed and flooded with trauma memories. So your unconscious, brilliant psyche says, I need to protect you. We are going to disconnect again through things like self-starvation, excessive exercise, being a marathon runner, anything to get out of your experience of your body self.
I like to say that trauma therapists are psychological foster parents who step in to heal the damage done by others, so then our clients can move forward as a whole and empowered individual
that they deserve to be.
So we have to repair those early attachment experiences. And we have to provide a new attachment template. We also need to understand, what are we treating? It's not just the symptom. I don't just treat eating disorders. I treat complex trauma. I treat what overlaps.
If we don't have hope, it makes it almost impossible. So we, the providers, need to be the keeper of hope until our clients can feel hope within themselves.